It's with that question that we straight away start that conversation. And the conversation is about the lifting of the lockdown and the actions of the citizenry, but more so what needs to be done in terms of how it has to be anchored on the type of enforcement and the sort of education that we need. But integral to all this is the role of the population. And you know, it is integral to everything that we have to do, because as I read on Facebook the other day, we are on our own. And if you don't take the precaution as what you think should be important, you leave yourself ajar and very much to infection. And that's why we decided to bring into the studio population health expert. She heads the National Population Council. Dr. Letitia Adelaide-Appiah is here once again. Good morning to you. How are you?
Good morning, and thanks for having me.
Great, great. As we begin the discussion, we'll be joined by Dr. Asian Beidu. He is a microbiologist, and he's also with the University of Cape Coast, who will seek his expertise on related matters of health, what the response team is doing, and what the best practices are, and what also we should be doing as citizenry. But first, Dr. Appiah, let me ask you. We talk about population distancing, the things that we need to do, etc. Now that we have lifted the veil of any protection as we got it in the lockdown, because officialdom through the personnel were monitoring, etc. What ideally should be what we need to be doing beyond what the precautions are?
Well, thank you so much for the opportunity. Yes, the president, as you rightly said, lifted the lockdown because he really needed to make a decision, either succumbing to the COVID or probably dying out of hunger. You know, and public health and economics, for me, it's two sides of a coin. They are one and the same things. At times, we tend to think that the economy is different from public health and public health is different from the economy. But it's for the same individual who needs to be healthy to be able to work. So with this lockdown out now, because people also need to work to make an income so that you can boost your immune system. And so it is important that we really appreciate our responsibilities as citizens. What I would still reiterate is that there's no vaccine. That is why this disease is so unique. Our children have vaccines all the time. The polio, for instance, is 3 viruses in one. That's the polio vaccine. But then it's a weakened virus. And so we take it and then we develop immunity. We do not have immunity. We cannot also stay and die out of hunger, you saw what was happening on the streets. The young men were on the street and all that, and so we had challenges. So it is important that we really appreciate the responsibilities that we all bear in this COVID fight, I may say, because it's really a fight for our common survival. In public health, it is also important the position in which you were before a disaster strikes. We had a population where hand-to-mouth, as we say, and if disaster strikes in a hand-to-mouth population, it is disastrous. So we have to, after this, consciously make an effort to make sure that our hand-to-mouth people are not that many through social interventions and other policies. Now, the critical thing for me is sticking to the protocols, the social distancing, the hand washing, using masks, hygiene etiquette. That is, for me, the treatment. Like if you have malaria and they give you the ACTs, if you want to cure yourself of the malaria, then you have to administer the ACTs. And that is the cure we have now for COVID-19. We have to, the president really was, for me, between the devil and the deep blue sea. Which side should he go? But then he has to also be in the middle to make sure that people are not dying and then people are also surviving. I mean, because it's still hand to mouth that we operate.
Yesterday I saw pictures going through town. People are having conversations, milling together or mingling, and just you know, walking about without much of a care. No face masks on. I mean, visibly you could see them. Those scenes and pictures that we see, how do they gravitate away from what you're preaching now?
I think the education hasn't gone down well. Everybody knows COVID-19, but then what does it entail? What are the risks? And what are my responsibilities? And we really need to break the responsibilities down to every segment. GPRTU has a role because GPRTU sees a lot of clients, and so they can customize this hand washing and social distancing using sanitizers their own way. If you go to the village where they're using the water pumps, the boreholes to fetch water, that is where people congregate. So they have to customize somebody to clean the handles, or everybody cleans after the person. We have to customize it. If you go to the shops, for instance, they have to come out with, if you look at CNN and all those places, they have marked points that you stand here and then you after. So we have to own it. If you look at the saloons, the barbering shops, they have to own it and customize it so that they protect themselves and protect their customers. But for the information, the generic has to go, and then the customization has to go. And we need to also engage our traditional rulers. Everybody has to be involved because this is a battle and everybody is on the battlefield. We all have our specific roles. The president is doing so well. The PPEs, now we have local production of PPEs. Our doctors are in readiness for just in case very sick people get to the facilities. And we also have to make sure that we play a role in the communities. The people are dying outside not because the doctors are not good, but when you overwhelm your system. Every system that's overwhelmed breaks down. So when you overwhelm your system, then you get the mortalities going up. So it is important that we play our roles in the communities, not to overwhelm our system.
Well, good one. For those who live in, good estates, easily gone, Kwadaso, some of those places, it's cool. Or you live in third rate, for example, in Cape Coast, you're cool. But look, if you live in the ghettos, it becomes difficult. How do you tell somebody that you have to, create a certain buffer, you stick things on the ground, your barbering shop, and do all that in a ghetto where everybody is overwhelmed because of the population density?
Well, in a war situation, you don't have the norm, and you have to think outside the box. So this is what the disease, the virus needs to continue to attack us. This is what we have to do to break the transmission. So what do? Because we live in ghettos, we just succumb and the virus takes over us? Is that the option? I don't think that's the option. But we need to find innovative ways of staying alive. It is important that we find innovative ways of staying alive. And then afterwards, we have to come to the talk about, is that how we want to live? Is that how do we want to continue to live in ghettos? Abroad, they had always lived, they also lived in ghettos, but then they've moved on. Do we want to continue to live in ghettos? Because viruses, this is not the last time they will come. Another will come. And do we want it to find us the way it's found us this time too? We have to make the decision and do the trade-offs. Because between public health and economy, there are always trade-offs. There are always trade-offs. You can choose to have 3 healthy children who will be resilient and will stand COVID because you would have a home where there's water and they are highly educated and they would understand. Or you can also have 10 live in a kiosk and then also, so those are the choices that we need to make after this pandemic.
Out there were extrapolations that were made, even in the WHO, raising related concerns about how we could have by June 300,000 cases overwhelming countries in Africa. Is it that we are insulated because of the actions we've taken, or because we just have a manageable situation and so we don't fall within those pressings?
Well, the disease is new. It started from outside. So I think Africa had and it came very late to Africa because we don't do a lot of travels. It's imported. And so we had the hindsight of studying how the virus operates. We really had an advantage. And in Ghana, for instance, we have gone ahead. We've done the surveillance. We've done the contact tracing. We've done the active really case searches in the communities. So we have done something good. And then also, I think that probably God is talking to us that we should change and looking kindly on us, because the virus is not as virulent as it is outside. And I think that we in Africa have had so many viral vaccines that somehow one or two of them is making this disease a bit mild on us. And that is why we have very few mortalities. And for the mortalities, you see, all those who went on ventilators died, unfortunately. Which means that the best ventilator we have is our nurses, because they also they are ventilators. So we have to protect it, keep the social distancing, so we do not get ourselves into the facilities and be on ventilator, because the probability that you may not come out is very high. The 9 people went on ventilators and none has come out.
Well, and that is why elsewhere, in some of the top hospitals in New York and the state itself, they decided to do the isolations, and unless you're extremely in a very respiratory bad condition, they will not put you on a ventilator. That's the new way they're doing it. But if we have to come with in country with the way the education needs to be done or the coordination needs to be done, what would you best advise in terms of how we have to carry forward with how MMDAs also need to complement the health facilities, and at the community level, who needs to be involved?
Well, the last press briefing, we had the Ministry of Information, Chieftaincy Ministry, local government, which means that it's actually a whole team, and that is how it's supposed to be. And then it will trickle down. It's already trickling down.
I haven't seen chiefs in my community, so I'm wondering.
Well, the chieftaincy minister was there at the press briefing.
Yeah,
and
true.
So yes, and so it will go down that way, because you cannot do anything in the communities without the chiefs. And when the chief speaks, everybody listens, especially in the rural areas. The chiefs will also help with the chiefs, and then the community will help in identifying isolation centers. You know, the treatment for this COVID is very simple. We test, and then if you identify as positive, we isolate. The main battle is with your immunity. So we isolate for you to get over the virus, and then you can move into the community. So isolation is important. That is why we need to get everybody on board, so we can come out with isolation centers, and then people will not resist that we don't want any isolation center in my community because it's very infectious. The issue is 25% of the time, the people are asymptomatic. And so you would not even know who has the disease or who hasn't got the disease. So we're coming together, and I know the Ministry of Information, the Ghana Health Service, local government, a chieftaincy ministry are all coming together. And then the religious authorities coming together to make sure that the information goes down. Information has to go down. It cannot be oversaturated. We need to talk about it all the time and make sure that everybody is abreast.
If you look at the demographics of the populations that we're talking about, and you look at the high end, well, if I choose to use that term in the first place, and I'm thinking that segment of the population will be those who have access to the information, are highly educated, and so will do what is appropriate and right. But we have a certain segment of our population who would need that sort of information more. Semi-literate, illiterate population within those endemic areas that we're talking about. How do we reach them beyond these traditional means that you have enumerated?
Oh, we have also the footballers. You know, we have role models. And so you have to look at the role models and make sure that you have a role model targeting whichever group. We have, in fact, COVID is telling us the most important things in life. It's really taking us back to basics. And so we still have the Gong people. We still have NCCE. That's everywhere in the communities. We have the local languages.
I haven't seen NCCE and all these people you talk about in my community. And my community is fairly ghetto. So I'm wondering.
Well, NCCE. So we have NCCE supposed to be. And the last time I saw the boss of NCCE on it, I think Talking Point, talking about what they are doing in sync with Ghana Health Service, with the Information Ministry, to make sure that it goes down. Because that is the only way. We have to, the structures are already there. And so it's not difficult to build on.
Are we not having a situation where you, the big men and women at the top, you talk big, but sometimes maybe it's not trickling as far as by way of implementation as it should?
Well, I'm not sure about that.
Well, we'll bring into the discussion a microbiologist, Dr. Samuel Esiembedu, to help us also deal with the related scientific research-based issues, because we know that we're told that a genome, that in terms of the type that we have of the virus, could be also traced to the original one that was seen and worked with in the labs at Wuhan. But ultimately, how does that move us forward as far as trying to look at the related interest issues? Now, let's talk about the population density of these areas that, and the president even announced some of them, and how that, for you as Population Council, becomes important in trying to map out what needs to be done. We're talking about the density and some of those areas.
Yeah, I think it's very, very important, because local ownership is critical. If you want people to uptake a behavioral change, then they have to own it, and they have to see their leaders in charge of it. And yes, COVID, what it hates or what it likes and we hate, it's being close together. And so population density for COVID, it's a ripe situation to propagate itself. So we need to, as the president said, targeted areas would have targeted interventions. We need to not just have, as you said, we don't just have to have the information up there, but we need to localize it and say, we come to this community, yes, you cannot have the 1 meter apart, but what can you do? You can do the mask. Everybody has a mask so that you do not transmit one to the other. And then the hand washing, we have the water tanks coming over, how to do the hand washing. You see, yesterday I was watching TV and I realized that people were wearing masks and they were wearing it wrongly. And so demonstration is also important, should be part of the education. So we need to segment and make sure that the team, we go there as a team. Ghana Health Service with somebody from National Population Council, and then from NCCE, we go there, educate them, so we can isolate those places, so they do not have to go into curfew, because Roland, the issue is those people there are those who also do the hand to mouth. And so if if they are contained all the time, it's also going to be a challenge. And so we need to have the education at the community level. Education, education, education.
Would it have to come at some point where we have to look at some of those hotspots, as had been referred to in earlier communication, where we have to perhaps be more strict or stringent in movements, just to make sure we enforce?
Yes, we have to do that. That is public health. Because if you find a hotspot and you do not isolate it, then it spreads. And so if there's a hotspot, we need to demarcate, isolate, and make sure that we test the people there, get them into isolation, and then treat them and trace the contacts. So and that is why the team is standing by, as the president said, to make sure that if there are any such hotspots, it's isolated and then it's contained. Because if it spreads, it gets so many and you spread so thinly, and it becomes a challenge to identify everybody.
But we already do have some hotspots, don't we?
Yes, we do have some. We do have some hotspots, and the team is doing the aggressive contact tracing over there to make sure that everybody is out. The other problem, Roland, is that you know, there's Noguchi and the centers, the testing centers, are overwhelmed, and so there's also a time lag between when we take the samples and when the results come in. That is why social distancing and going by all those protocols are critical, because you would even know whether you tested positive some days after, when you would have infected or you have come in contact with so many other people. So it is important that we all pretend as if we have the virus, because if you test and we realize that it's positive, you're still going to go into isolation anyway. And so let's pretend that we all have the virus and keep ourselves in some sort of self-isolation and not come out if you don't have to. Yes, the president says we can come out, but you don't have to come out if you don't have to.
Yeah, yeah. Okay, so we do have Dr. Samuel Esiembedu, microbiologist with the University of Cape Coast, but also integral related issues of testing. And we have to straight away talk about what we're seeing under the microscope. Good morning to you, Dr. Isiambedu. What we're seeing under the microscopes it gives you, the scientists, the confidence to say that this is under control so far?
Good morning, Roland, and good morning to all your viewers. I think so far, so good. From everything that has happened so far, it's been wonderful. There's a lot of work that has been done by Noguchi, KCCR, in making sure that we understand the dynamics of what we're doing in terms of the testing and all of that. And I'm sure you're also aware of the breakthrough research from WAPIP, where we've been able to sequence genomes of the virus that we have in our country. So far, so good.
Now, how important is it? The president mentioned that in his speech, and you could see that immediately he said that his lips or his face just lighted up a bit. How important is that?
It is very important because if we understand the dynamics of the virus that we're dealing with as a country, it also helps in further research to unravel and facilitate therapeutic interventions as to what we should be looking out for in terms of vaccines or treatment regimens and guidelines as a country. So this is very, very important and a very good news to all of us.
But the reality is that when it comes to the crunch, those who walk the streets, those in those difficult situations, and Dr. Letitia Appiah here had been talking about those who live hand to mouth. And we all do know that people need to survive. Now, while we see at the research side good news, we also do know that that has to translate in their livelihoods. At what point in time do we need to make sure that they need to do what is right? So that what you see there in the scientific field or in the laboratories, really, you're hoping that will give you comfort based on what you see on the ground.
I think at all times, Roland, we need to ensure that everybody complies with the laid down protocols, particularly with regards to issues relating to social distancing, isolating ourselves, hand washing, and personal hygiene, and all of that. Now, there are two key things here. We have what we call the transmission frequency and the transmission efficiency. Now, for the transmission frequency, that is the cycle at which an infected person infects the next person. Now, if it becomes so short, what it means is that we'll have a larger number of people becoming infected within a very short period. Now, the efficiency is about people who are able to have or possess the virus and then would have the tendency to transmit the virus to another person, whether they become active carriers or they become asymptomatic and all of that. Now, if you put these two together, basically, all of us need to come together to ensure that the strategies that have been put in place to mitigate the spread of this virus is adhered to completely by all of us. Now, we need to make sure that we break the frequency of transmission, and we also need to make sure that we minimize the efficiency of transmitting the virus. So what it means is that we need to isolate ourselves, we need to distance ourselves, we need to wash our hands regularly, we need to make sure that we practice all the hygiene tenets that have been laid out, we wear our face masks and all of that, and then we should be good to go in bringing this curve down properly.
Now, I have to now get to you, Dr. Appiah. When you say that, oh, treatment of COVID-19 is simple, what really do you mean on the clinical side?
Yes, what I'm trying to say is that now the preventing, as Dr. Isiambedu said, is just adhering to the protocols. So that is, we know that. We know what to do to break the transmission. Adhering to the protocols of social distancing, hand washing, wearing your mask, and then, isolating yourself and keeping away from each other, non-essential contacts. That is what we have now. They're in the lab sequencing the genomes to make sure that they can have vaccines for us so that we do not have to get into this social distancing. We're not doing that for either viruses because they are vaccines. But that is what the scientists are doing now. So whilst they are getting ready and they're doing all they can to get us vaccines and medicines to break the transmission, what we have to do is to do the social distancing in wait for them. It is important that we appreciate it, that they are doing this on our behalf, and what we can do to make them fulfilled is to adhere to the social distancing norms and all the protocols so that when the vaccines are there, we will still be alive for them for us to have the shots, and then we can move on with our lives.
Dr. Esiembedu, what you scientists are doing, how does that translate to the pharmaceutical sector locally?
So I think for now, locally, what we do know is that we have been able to sequence the genome of the virus that we are dealing with, and from the work that has been done at WAPIP, the similarity between what we have here and what started from Wuhan and elsewhere, it's that high. What will happen basically is that we now have to study the other dynamics of the virus in terms of the formulations that the pharmaceutical industries will come up with as to what we actually need as an active ingredient in whatever formulations we have to target the virus and then knock it off once and for all. And I think that is the biggest breakthrough we've had as Africans and then as Ghanaians.
And I know that you trained in China, so perhaps you know the socio-cultural norms of the Chinese better. But you see that since the middle of February, they've had their cases very much stagnant, if not the beginning of March, so to speak. I think that's more appropriate. And rather, we've seen cases spiraled into big numbers that have become a concern to all over. In America, elsewhere in Europe. But just about 2-3 days ago, we just had some extrapolations made, even the WHO also in support this morning, that we could have some cases, about 300,000 affecting Africa, etc. If you read or observe all these that are happening, what keeps us and makes us different in Africa and in Ghana? And I asked the same question also to Dr. Appiah, so I want your views on the subject, Dr. Esiembedu.
Okay, thank you, Roland. I think that when the infection started in China, there were two key things. One was that there was aggressive testing and expanded testing. So testing sites were expanded, new facilities were built. Aggressively, they tried to break the transmission efficiency. So the frequency at which people became infected slowed down with time. And I think that the whole world, particularly in Africa and Ghana, we've learned a lot of lessons from what happened in Wuhan, Italy, USA, and the likes. And that is what has translated into the measures that we have put in place to mitigate the spread of this virus.
And Dr. Appiah, you say that our population is also critical to this. We don't have too many of them clustered, do we? Dr. Appiah, I'm talking to you.
Yeah, you don't have too many of them clustered well. Yes. Yeah, population density is critical in the COVID because it's through droplets, and now we're talking about aerosols, and through coughing and sneezing, and so the closer you are to each other, the easier it is to transmit. And if you look at the other countries, for instance, if you look at Sweden, look at the other places where in Sweden there's no lockdown. If you look at their population density, it's really sparsely populated. And so they're doing some kind of social distancing even in their calmness. And so that really also is important in transmitting the virus.
Okay, Dr. Bedu, as we now try to wrap up this discussion, the decision taken by the president, of course we can fight it. All over, coronavirus is always an economic and a political issue, so that's on one hand. But going forward, are we likely to see a situation where if we have hotspots increasing, cases being recorded in particular areas, then we need to go in for the jugular, perhaps shut areas down in between, not nationally, etc., or just communities, and so then we can do the isolation?
Okay, I think that epidemiologically and demographically, these factors need to be monitored carefully. I think the approach so far has been, what do we need to do to break transmission? What do we need to do to limit the number of people that have become infected? And this approach is very, very important in that lifting the lockdown partially does not mean that all those other factors or approaches that have been laid down earlier on would be taken off the table. Now, what we need to do is basically to adhere to the approaches that have been put in place. So the first one is to break transmission, and we make sure that we adhere to all the hand washing practices, wearing of the mask, washing our hands and all of that, disinfecting and all that. And then number two, we need to also encourage people to honestly report signs and symptoms so they can get tested and managed appropriately. Now, the situation where we are likely to have people stigmatizing others who may have had the infection is likely to prevent people to honestly report. And in that case, what will happen basically is that these people will get threaded into the communities and continue to spread the infection. So the second approach would be for us to make sure that we encourage people, educate people to honestly report signs and symptoms so that they can be managed appropriately. And then the third approach, which I laud the government for, is the expansion of the testing sites. Previously, it was just 2 sites, but now we have additional sites, the reference laboratory, the public, and also might turn out time of the testing procedure so that such people can be identified early and then managed appropriately. And again, I want to add that we need to also enhance our surveillance systems, where we have a team in place that is monitoring the contacts that have been traced, whether primary or secondary contacts and all of that. That is very important in making sure that we mitigate this pandemic entirely.
Well, Dr. Appiah, now we've come to where we are. Everybody is thinking life has returned to normal. I mean, realistically, you manage related issues at the National Population Council. Is our life back to normal?
No, Roland, not at all. Our life is not back to normal. We were on lockdown so that we can break the transmission, so that we can do the self-isolation. The main thing is to break transmission, and also those who have the virus isolated and treatment. So we are not still in normal times yet. We just been left up a little, so we will not starve. We will not starve of hunger whilst trying to deal with the virus. And so, as the doc said, it is important that we work with stigma. We really have to work on stigma and make sure that those who have the symptoms are out and then for isolation. Yes, now the treatment sites will be all over in the regions, and so should isolation sites be. Because if you identify the cases and they are in the communities and they are in compound houses, they need to be isolated and treated before they come back into the general community, and they need to be comfortable in isolation. So the treatment, the isolation sites, and stigma should be something that we should try and really get out of our system. Because we have a lot of the surveillance people standing by to make sure that they identify the cases, active surveillance, and then the normal surveillance when they come to the facilities. So the surveillance, isolation, and stigma should really be dealt with. Then in no time, we can get rid of this and make sure that the scientists also take their time to get us the vaccines that do not only work, but also safe for the population.
Now, Dr. Bid, if we look at the perception that we tend to have right here, and socio-culturally, how we seem to think that because I'm not infected, or we don't have the numbers, then it gives us confidence. It also means that gradually we tend to forget what the cautions are, what the guidelines or the protocols are. It will also mean that people will see it as just a normal thing. Now, scientifically, when do we psychologically need to see this virus as just one of those that are inherent in public health, so to speak? And so we just take it as coolly as it is and not as an emergency. At which point in time should we be doing that?
Not until we have a credible vaccine or an authenticated therapeutic agent that can deal with the vaccine. I think that education is key. We need to continuously educate people about the virus, the mode of transmission, and how it spreads, and all of that. We need to tell people about all these, what is happening in other countries and all of that. I think we've started a very good thing by using people who have recovered from the infection as mouthpieces in educating people so that we could minimize the extent of stigma and all of that. We need to continuously engage the public. We need to drum home the education on the spread of the virus and the fact that you can have it. You can be asymptomatic and so may not show any signs and symptoms, but you can become a conduit to transmit the virus to other people. And that is very, very important. So we need to continuously educate people on the transmission of the virus and make sure that we do this, and we make sure we get a vaccine or a therapeutic agent. And then even after that, we need to make sure that we encourage people to keep safe, practice personal hygiene and all of that.
Mm. And Dr. Pia, we can have people who are asymptomatic, as we call them, but may not necessarily get to the stage where they are exhibiting the signs until they recover.
Yeah.
Okay.
Yes, that is why outside you're testing the antibodies. The antibodies tells you that the virus has been here. You've had the virus and you've recovered. You know, the immune system is very, very strong and very efficient. And so a lot of the cases, you may not even know that you have the virus, but then you can be a conduit to give to somebody else. So you can, if you do not take care of yourself very well, you can go ahead and infect your grandma, your uncles who have some comorbidities. That is why we all have to protect ourselves. And for me, the hand washing and this hygiene etiquette does not only prevent COVID, it prevents so many other cholera can be taken care of, and so many other infections that would really help our NHIS. So it is important that we stick to those protocols, and hand washing with soap and running water should be a common thing. It should be something that, in fact, we should have been doing that years back. So it's a habit that we should cultivate. Coughing in somebody's face, it shouldn't be just for COVID, but it should be something that we should, it should be a habit. It should imbibe in us, and we should start from the schools. So now with COVID, it should be in our curriculum in kindergarten. Hand washing, don't look in somebody's face. So we grow with it. So in case there's a COVID some other time, it will not, the impact will not be so felt so greatly.
Mm. And Dr. Isiembedu, what lessons have we learned by way of education for research and development, policy direction, and then also maybe among the population?
So I think one of the biggest lessons we have learned is our preparedness for future pandemics. There's been a lot of talk about funding research in Africa and in Ghana especially. There's a bill in Parliament on research funding in Ghana, which is still lying in Parliament. Imagine if this pandemic had happened and then we had about 10 or 15 Noguchi-like or KCCR-like facilities. We would have had expanded testing sites and all of that. We had other centers where they could do genome sequencing and all of that.
And also working closely in research, especially in these times, and has been very much involved in all this. And he also works with the University of Cape Coast, teaches there as well. So anytime that we want all this, we can always go to him. Thank you for having you, Dr. Samuel Esiambedu. And also we've had Dr. Letitia Adelaide Appiah, Executive Director, Executive Boss, National Population Council, always telling us that, look, we need to make sure we keep the protocols within the distance, and it means that husband and wife will cry. If you're in the hall, you sit at one end. No. It doesn't mean so, right? Well, thank you very much, Dr. Letitia. And look, we were happy that you've also been able to educate us. She is Executive Director of the National Population Council. We have to take a break, but please make sure you keep this conversation going on based on what you've learned. And these learning outcomes should better educate us and put into practice. Get interactive. Facebook, Joy News on TV. We have a Twitter handle at Joy News on TV. And when we mention them, make sure you follow us. So Facebook, follow us. Follow us also on Twitter, and then subscribe to us on My Joy Online TV on YouTube. Now, click notification buttons so that when we upload videos, we post things for you, you can get those notifications and access them, okay? All right, we're taking a break. When we have the next segment, we'll tell you all you need to know right here, Great Education on the show.